Yep, it is working. So thank you all for being here. I appreciate the advocates being on time and organized, and don't they look great? But thank you all for being here. Today we are releasing Advancing Safer Communities in Harris County, a report developed in partnership with Georgetown Law's Center for Innovations in Community Safety. This report is built on one simple idea: providing the right response at the right time makes Harris County safer. We've had 4 years of results to prove that these programs work. Now the challenge is for us to make these programs permanent instead of piloting them. This matters. For too long, our public safety systems have been structured to respond after harm has occurred. But if someone is experiencing a mental health crisis or a gun violence incident or trying to escape abuse, responding after the fact simply is not enough. Since 2022, we piloted programs rooted in prevention, coordination, and care because people can't be prosecuted out of poverty. Mental health and substance use can't be treated in a jail cell. Survivors deserve a path to safety before violence turns deadly. In Harris County, our holistic assistance response teams, or HART, have answered more than 31,000 calls. Let me say that again. They've answered more than 31,000 calls, connecting people to the care that they need. Our community-based violence interruption program, RISE, has prevented at least 180 incidents of violence and conducted more than 30,000 engagements. Our domestic violence interventions have helped more than 5,000 survivors and their children leave unsafe situations and get the care that they need. These programs save lives. They save time by freeing up law enforcement and EMS for the work that only they can do. And they save taxpayers dollars by reducing reliance on jails, courts, and emergency rooms. We have a real opportunity in Harris County. The question is, before us, we have a challenge to invest in these programs that work, and we know that they work, and we need to do it now. That's why I'm calling on Harris County to invest $4.5 million in investments to do several things. Scale the HART program and provide responses 24 hours a day, 7 days a week. Number two, expand into more communities with our RISE program. Number three, sustain domestic violence interventions. And four, open a dedicated Department of Community Safety to coordinate these efforts for the long term. These investments pay for themselves by preventing costly crises before they happen. Harris County could save more than $5 million in detention costs and legal system costs alone by implementing these programs. This total proposed community safety budget equates to 1.5% of Harris County's current spending on law enforcement. It's important to mention that these programs complement law enforcement. They do not compete with them. Community safety isn't either or. It requires all parts of the system working together. And now I'm pleased to introduce a national expert and the co-author of this report, Mariela Ruiz Angel from Washington, D.C. She chose to stay up there where it's 100 degrees instead of being here. And she's going to join us virtually at this time. Hope you can see her behind us. You can.
Thank you, Commissioner Ellis. Can you guys hear me okay?
Yes.
Thank you so much. And thank you to the entire Harris County team for the opportunity to join you today. I serve as the Director of Community Safety Initiatives at Georgetown's Law Center for Innovation in Community Safety, where our work focuses on helping communities build stronger, more effective approaches to community safety and reducing the over-reliance on traditional law enforcement responses. Through our work at Georgetown, we have had the opportunity to work with and learn from community crisis response programs across the country. As communities have asked themselves, when someone calls for help, who is actually the right person to respond? We have consistently seen that the answer doesn't always have to be law enforcement. Our goal should always be to send the right response at the right time. And that is exactly why the continued development and expansion of HEART and RISE, as Commissioner Ellis said, is so important. These programs represent a broader evolution happening in community safeties across the country. We are moving beyond asking whether alternative response can work. Communities now have years of experience, right? Since 2020, and even before that, we were showing that trained civilian responders and peer support specialists can safely address many calls that historically have defaulted to law enforcement. And Harris County has its evidence. I was very proud to see, right, in 2022, HEART has responded to more than 30,000 calls for service, calls that otherwise, and again, this is about complementing, that would have required hours of law enforcement or EMS to respond to. And in 2025 alone, HEART responded to over 8,000 calls. Those responses have freed up thousands of hours for traditional responders, reduced arrests in situations better served by health-based responses, and connected thousands of residents to longer-term resources. That is the goal. That is the goal, is to break the cycle. So we don't have to speculate about whether these models have value. They do. And Harris County has already shown us what is possible. The work now is about building these programs to last, expanding their reach, and making them more permanent and part of our community safety ecosystem and infrastructure. You're not putting Band-Aids anymore, right? What we're really thinking about is how do we build a more complete community safety system? When we talk about this, right, we talk, and as somebody who's built these programs, we talk about this as police have their role, EMS and fire have their role. Well, now this has a role too, right? This is the evolution. We have social workers and peer support workers and clinicians and professionals, right, behavioral health professionals who can ultimately now be essential to what really means, right, a safer community. A strong community safety system recognizes those distinctions, and it ultimately builds the infrastructure. And so that is part of why KICS and Georgetown were so excited about this report, because this was really about making it clear that there is still room to grow. So I support Commissioner, right? We know that today, less than 2% of your 911 calls in unincorporated Harris County are tagged as eligible for HEART response. That's wonderful. So it's a big start. But with more than 400,000 calls coming into your 911 system each year, even a modest increase in the percentage of calls that could be appropriately routed to HEART could mean that thousands more people that they could be receiving a health-based response instead of an unnecessary law enforcement response. So this isn't just an opportunity for HEART or for RISE. This is an opportunity for the entire Harris County public safety system. It means getting residents the help that they need. It means less moral injury for fire and police when they get to a call that isn't for them and they don't know where to take people and they don't know how to respond to their mental or behavioral health issues, right? This truly requires a specific type of expertise, and you guys have been able to do that extremely well. So, I reiterate a little bit that this is really about taking what this alternative was, this alternative response system, and now making it an essential public service. So in our perspective at the Center for Innovation and Community Safety, this shift marks a new phase in the field. We've already demonstrated we can do this, right? That was the initial ask. Can we create a different response? Can we demonstrate it works? Is it safe? Yes, we know that. The data, the stories, there's many cities across the nation who have done this have proven this. Now this next phase is about permanence. It's about sustainability. Can we build the infrastructure? Can we create the workforce, right? Is the funding in place and the policies and the governance? So we know that this is more than just creating programs. This is now about connecting all of these dots together. So it doesn't just matter what's happening in Harris County, right? I love that you guys are able to do this. What really matters is that Harris County is pushing the larger movement across the country and the nation. So these communities are no longer simply experimenting, right? We are actually moving this into systems of care. And one of the most important ideas of this report is that, HEART and RISE cannot live on an island, and they can't live in this little bucket in this large place, right? They need to be elevated. They need to have their own place, right? And we've seen this now through many cities like Albuquerque and Durham and Seattle, where they've created very specific departments so that these have, right, the prioritization, that they have the escalated, right, views, that people are actually making them an agenda item and not just another program. So we support this push to around our department. And this is actually more than just that, right? When we think about HEART, RISE, domestic violence, traditional first response, right, we really are thinking about the opportunity to build that structure and then work within the current other systems, from prevention, through stabilization and long-term care. All those things matter. So I will start to wrap up. I'm excited for this, but I also know that this kind of work does not happen without political will. And so I will say that, Commissioner Ellis has been an important champion of that work. His team has continued to push. I know because I'm on the phone with them, I'm working with them, I'm trying to connect them to cities and other folks who are doing this so that they can really understand how to do this well. But, creating something is hard, but sustaining it is even harder. And so I commend you all for pushing forward. It represents a fundamental shift in how communities really think about safety, away from a one-size-fits-all response and toward a system permanently capable of delivering the right response at the right time. At Georgetown, we have the privilege of seeing this work developing across the country, and Harris County isn't on the sidelines of that national movement. This potential change, these advancements, it is the opportunity for you guys to lead this effort. HEART and RISE have already demonstrated what's possible. Now the opportunity is to take what works, build it to scale, and make it last. I'm excited to see all of the continued work, and I'm grateful again to Commissioner Ellis, his team, the responders, the many community partners, and the residents who help make these programs possible. Thank you.
Thank you, Mariella. And before you moved to Washington, D.C., she was in charge of community safety in Albuquerque, New Mexico. So you're going to hear from three more people. I'm going to tell you who they are, and they'll come up in this order. Deja Griffin, lead case manager for HEART. Deja Griffin serves as a lead case manager for our HEART program. Her work supports HEART's mission to connect residents experiencing behavioral, health, and social service needs with appropriate care and community resources. And then Larry Carrington. Larry Carrington serves as an outreach specialist and public safety liaison with RISE. He's doing a great job out of the Sunnyside area, South Park. I saw his video last night, and he is a rock star. It's going to help us push these programs. And then the last person will be Barbie Brashear, Executive Director of Harris County Domestic Violence Coordinating Council, a longtime leader in domestic and sexual violence field with decades of experience supporting survivors and strengthening community responses to violence. So in that order, Deja, Larry, and then Barbie. Thank you.
Good afternoon, everybody. My name is Deja Griffin. I am the lead case manager for the Holistic Assistance Response Team, also known as HEART. I have been with this program for 3 years, starting off as a crisis intervention specialist in the field, and then being promoted to lead our case management team. I started off in mental and behavioral health as a psychiatric nurse technician while I was in college. From there, I worked my way up in a small psychiatric hospital. Then I was in a car accident of my own, and in the middle of the recovery process, I found HEART. Sometimes something about being cared for in the hardest moments of my life made me want to be that person for someone else. A lot of people we support don't always feel like they have a voice. They don't always know what help is out there or how to access that help. As Commissioner Ellis shared, since 2022, HEART has answered 31,000 calls across Harris County. For every person, that's a neighbor, that's someone's son or daughter who needed someone to show up and support them through what might have been one some of the hardest moments of their lives. I think about a client that I responded to that had a mental health crisis and a substance abuse issue. She was paranoid, she didn't trust law enforcement, and she was in and out of touch with what was real. A neighbor who knew her well knew that something was wrong and called for help. When we pulled up in our purple and gray vehicles that wasn't black or white, that alone helped her trust us. Our team introduced ourselves with smiles, radios, and resources, and that gave us room to connect with her. I talked with her, I calmed her down, I was able to de-escalate her and get her to be assessed by a mental health facility, instead of just being removed from the scene. Law enforcement did arrive, but I was able to keep her calm and walk the officers through what she needed and also what she was experiencing. She got the treatment she needed instead of experiencing harm or being arrested. And that's the outcome we are able to create when we have the opportunity to show up and support. If we hadn't been there, that call could have gone very differently. An escalated encounter with law enforcement, an arrest, jail time, and the legal cost that comes with all of that. Instead, she connected to the care that she needed. Nobody got hurt, and the county didn't spend tax dollars on an outcome that wouldn't have helped her or anyone else. That's what this work does. It supports the person in front of us, it de-escalates what could have been a crisis, and it saves taxpayer money in the process. Right now, HEART operates on limited hours, which means that at 2 a.m., they have nobody to call on. With a deeper financial investment, we can move towards 24/7 coverage, so no one has to wait for the right kind of help to show up. More teams like ours mean shorter wait times and the capacity to intervene, advocate, and stay with people through the hardest times, not just in the moment of the immediate crisis. We're not here to replace law enforcement or EMS. We're collaborative partners. We're here so that they can focus on the calls only they can answer, while we focus on the ones that require more patience and the capacity for de-escalation. This investment isn't just a budget line. It determines whether the next family gets someone who can offer them real help when they need it. I've watched what happens when someone finally feels seen and heard. It changes the whole trajectory of a family, and sometimes it saves a life. Thank you for Harris County for what they have invested thus far. I hope we can expand this investment so our team can reach and support community members in need. Thank you. I will now introduce my colleague, Larry Carrington.
Good afternoon, and thanks for having me. My name is Larry Carrington. I'm an outreach specialist for the Southside team of RISE, and RISE stands for Relentless Interrupters Serving Everyone. And we serve the neighborhoods of Sunnyside, South Park, and Greater OST, which zip codes are 77021, 77051, and 77033. I grew up in South Park, and by the age of 14, I was hustling and selling drugs, trying to take care of myself and my older brother. By 2010, I was a single father raising 2 boys on my own, and when money got tight, I went back to what I knew because I didn't want to let me or them go without. So in 2013, my apartment was raided while my twin boys were in the other room sleeping. So that moment broke something inside of me. And because I realized that if I went to prison, my kids would have nobody to care for them. So by the Lord's grace, I was able to get those charges dismissed. And since 2014, I've been working a full-time job. And roughly 2 years ago, my old high school coach and fearless leader, OG Russ, brought me into RISE. And Russ knew that I had turned my life around and thought I could help other people do the same thing. So when I think about the work that we do at RISE, there's a kid who comes into mind. When I first met him, he was 15 and roughly 16, and went to one of the high schools that we have a presence in. The moment I looked at him, I saw myself in him. He had began getting into fights, and he had gotten caught with a gun on the campus. So he was about to end up in the juvenile detention center, but the administrators asked us to step in and talk to him. So we took him into a conference room and we sat down with him. Me and more of my team here, we sat down with him, and he told us that the love that he had for guns, and that he never goes anywhere alone or walks anywhere because in fear of something happened to him. So we told him straight up that we've been exactly where he's been, and we know what if he continues down that road, what's gonna happen to him. So as we reminded him of this, and then we asked him, could we pray for him? And then at that moment, he told us that he asked us what was prayer. He didn't know what prayer was. So I knew then that it wasn't his fault with the stage that he's in. He didn't have it coming up in his own household. So we became his village. So I believe without the relationships we built with him, I believe he was headed to one of three places, either the penitentiary, the hospital, or the morgue. So today he's living with his father. He's at a new school and he's doing much better and thriving. So since we started, RISE has stopped at least 180 violent incidents before they've happened. We've mediated more than 27,000 conversations out of these neighborhoods, and we sat bedside with more than 2,300 people who have been victims of gun violence. It's a lot cheaper to have someone like me to sit with a person in crisis than it is to arrest, prosecute, or LOXO save county dollars. With more investment from the county, we can put more outreach specialists on the street and reach neighborhoods we're not in yet, because gun violence doesn't stop in one zip code, and so neither should we. The investment isn't just about the conversations we have at schools or in barbershops. In the mental health, it's the mental health support we offer who need someone to talk to. It's setting somebody up with a job, with job training, or helping them get their TWIC card so they can get a full-time job and get out of the streets. I know from my own experience that if you hand somebody a way out to put a gun down and a real chance at supporting themselves and their family, they're going to take it. I do this work because I want to help clean up what I once helped mess up, and because I believe I can change if somebody's willing to help them. I'm grateful for my second chance, and I know a deeper investment in RISE means there can be more stories like mine. Thank you.
Thank you, Larry. Barbie? Thank you.
You're welcome. How do I follow that? The two of you are amazing. Deja, Larry, my goodness, how lucky is our community? My sincere and deepest thanks to Commissioner Ellis, who I've determined is quite the most brilliant man.
Good stand.
That's how you're brilliant. Look at what you bring together. The great connector, the relationship builder, the community mender. My heart is full of gratitude for you. I'm Barbie Brashear. I'm the Executive Director of the Harris County Domestic Violence Coordinating Council. I recognize that as a great privilege and honor that I get to be in a job that I love. Not everyone has that luxury, so I do not take that responsibility lightly. I've spent my career, my life's work doing this. I grew up in a home where there was violence, thought it was just fighting like everybody else. That's what families do. And not until I was educated did I know differently. That's where the passion that I have was born. This work has taught me that safety is not created by one person, by one system, by one agency, or one intervention. What you heard from Deja and Larry truly demonstrates that. Sometimes safety is a crisis responder showing up at just the right moment. Sometimes it's a trusted outreach worker preventing the violence from ever starting. And sometimes it's reaching a domestic violence survivor before that next assault becomes fatal. Innovation means Harris County has been willing to ask, How do we intervene earlier and prevent it from happening in the first place? Harris County should be really proud of this. HEART, RISE, and our domestic violence investments address the very different while they address very different needs, they share the same principle: the right response to the right person at the right time. That doesn't replace traditional public safety, it strengthens it. Domestic violence makes this especially clear because we know that there are opportunities to improve pathways to safety, and our systems must take this proactive approach. A survivor may need law enforcement and prosecution, and she needs advocacy, she needs housing, she needs childcare and transportation. She needs flexible funding assistance that allows her to decide how and when she needs something. Dollars that go into her hand with her choice. No single agency can do this alone. That is why coordination and collaboration matters. One beautiful and innovative intervention in our county has adopted this is the Domestic Violence Assistance Fund, which has created ways for survivors to define how they need to be served with direct low-barrier financial assistance to get just that. This, combined with our high-risk team, which is a team that is a multidisciplinary team that works collaboratively to surround the survivor with supportive case management, as well as find opportunities and new pathways to find safety. That, combined with that Domestic Violence Assistance Fund, meant the sky's the limit. We can now look at these cases differently and provide services differently. Harris County hasn't just talked about new approaches, it's invested in those. The Domestic Violence Assistance Fund, as you heard, has served over 5,000 women, men, and children. That's not just a number. These are our neighbors. These are our sisters and brothers. These are the kiddos going to school and playing in yards and running down the street, right? This is us. A survivor doesn't experience these traumas as separate, or the programs or systems that she is seeking interventions from as separate. We all experience one life. And our kiddos experience that life with us. Our responsibility is to make sure that our systems work together around survivors, around victims, and for those families. Domestic violence investments are helping survivors get to safety and helping their children to heal. Together, we're working to change the trajectory. Oh, I can't speak. It's because I'm so nervous. I'm so sorry. Together, we're working to change the trajectory before the worst outcome occurs. Prevention is public safety, and case management is prevention. These people right here are demonstrating that every day. As we heard Commissioner Ellis say, it's not an either or, it's an and. We need HEART, and we need RISE, and we need domestic violence assistance, and we need housing and behavioral health services and flexible funding and high-risk interventions, and we need other systems that address the accountability required to increase safety. Real public safety means knowing what each part of that system does and ensuring that those parts are working together. It's a time to work so much smarter because we're already working harder. The choice before Harris County is this. We've built and tested these innovative approaches. Now we have to decide whether successful interventions remain temporary or become a part of how we do business. As you heard, the report calls for a $4.5 million investment. Commissioner Ellis said this is a drop in the bucket. This is an investment as a taxpayer I want to make. I want to invest in my brothers and sisters and kiddos and families. We must allow HEART and RISE to expand and grow. We must sustain domestic violence interventions, and we must strengthen the infrastructure that supports this work. Harris County has an opportunity to continue building a different kind of public safety system, one that responds when harm occurs and recognizes this risk earlier so that action can be taken before it becomes irreversible. We know more today about preventing violence than we've ever known. We must have the courage to act on what we know. I hope that Harris County will continue to innovate, continue to invest, and continue to lead. Safety is more important than surviving the most awful moment in our lives. Real community safety means creating more opportunities so that worst moment never happens at all. It's my honor to bring Commissioner Ellis back to the podium.
Thank you, thank you, thank you. Barbara, you did a great job. I wish I could learn how to read off that iPad instead of going old school with the paper and flipping pages. I want to thank Mariella, Deja, Larry, and you, Barbara. You did a great job. I want to thank my staff members who put the work in on this. They don't get the applause, Sophie and other folks. All these programs really started, I guess, when they were making arrangements for George Floyd's funerals. The last one was in Houston. So I pulled my staff in and I said, we don't want to just pass one of those resolutions. Come up with a list of things that we want to do. And of course, I thought we'd do them right away. They came up with a list of items. These are ones that I carried for Hart and Rise, by the way. We took a very methodical approach. Some of it might have taken a year and a half or 2 years to look at best practices all around the country. That is in part how we connected with Georgetown. But a lot of thought was put into these programs. It was not done but a sleight of hand. I want to run through briefly where the money is going. $4.5 million is the additional budget request for a total budget that represents about 1.5% of the county's annual spending for law enforcement. Here's the breakdown. $1.4 million for Hart, $600,000 for Rise, $1 million for domestic violence interventions, $1.5 million for operations centralized functions, opening a separate department in a multi-year approach. That is what we're asking for. If you take the current fiscal year 26 budget and the community safety, it is $10.8 million. That would constitute $5.9 million for Hart, $1.9 million for Rise, $2.5 million for domestic violence interventions. And it is extremely important. I want to thank the advocates. I know it's lunchtime. You know, I was wolfing down my little salmon. I did tell them, go get some pizza. Looks like we didn't get enough. But what else would you all do in 100-degree weather today but be here? So let's open it up to questions from the press. If you have any questions, we're happy to try to answer them. Okay, thank you. Can y'all treat us to some pizza? What'd you say? Oh, I couldn't see. Go ahead.
I guess just from like yesterday, we saw a lot of discussions around the budget for the county coming up. There's a lot of uncertainty on sort of how all this is going to work. How are you going to kind of use this report to kind of convince commissioners this is something that needs to be invested in?
I think because it is a relatively small amount, 1.5% of the law enforcement budget, and because I hope that is revenue neutral. We're convinced, based on our internal research, it'll save the county about $5 million in jail costs that we'd have to spend. Now, the Office of Management and Budget has not given their analysis of that yet, but it'll be somewhere around that neighborhood. So I hope that it will be a wash. And I will say to my colleagues, I think after all of the research that has gone into it and the statistics that we've gone through, we really cannot afford not to do it. You know, some of the advocates here were with me when we were pushing misdemeanor bail reform, which has been the biggest driver on reducing the number of people who are in jail in Harris County. Misdemeanor bail reform. But I think that the programs that we pushed together with this group in the past have proven to be successful. So I'm hoping that my colleagues will pay attention. Okay? Any others? You look a lot better in person than on the phone, by the way. All right, thank you all. Thank you all. Good job. Yeah, good job.